My name is Richard Mwangi. Our organization is called Doctors of Hearing. Sole purpose is to assess patients' hearing and how best their hearing is. So we are here at Dogoro Primary School, Lower Kabete, to do the hearing screening. And the numbers are high. As for now, you've seen about 300 patients for the hearing screening, where you find them having different degrees of the hearing impairment. You find about mild, moderate, moderately severe, severe, and also some profound cases where they have had a hearing impairment for over a long period of time. It has not been managed, where management of the hearing is as simple as if this fallen body in the ear, it should be removed. If the patient has got what we call nerve hearing loss, where the nerve has been affected, should be assessed early enough and management to start. Management of these cases, especially is hearing impairment as a result of nerve damage. It's using the hearing aids. And today we are giving some of the hearing aids as our corporate social responsibility at this side of town. We intend to have more. In March we had one in Eugenia County Hospital, and we have planned to have 5 more hearing screening, and will be of different areas in this country. Today's service is free of charge. We are not charging patients a cent. In fact, we also come with a ENT doctor, Dr. Joroge Mohoho. He's a ENT consultant ENT doctor, who is doing the clinical work. If the patient's got infection, you've got wax impaction, he's doing the ear silaging, ear cleaning, and also if the patients need some prescription medicine, we have offered and we have brought the medication with us, and all these services are for free. We are not charging any patient for today's service. We didn't charge the patient also for the services that we had at Eugenia County Hospital, and we plan to have the next 5 corporate social responsibility for free. We will not be charging a cent. See, what we find statistically is that the hearing impairment happen at any single age. Somebody can be born with it, somebody can acquire it. So what you say is that if somebody has been born with a hearing impairment, we say it's a congenital hearing impairment, and it needs to be assessed as early as possible. What happens, they say, parents say, but the child cannot talk. There's some few things you can do in the house. We try to clap the baby, we try to call the baby's name. We try to do as much as many things as the favorite cartoon for other children, and see the child is responding. But more so is that this is what you call milestone. When the baby starts walking, when the baby starts crawling, all those things are good pointers that you should check whether did the baby bumble at the right age, or at what age did the baby start bubbling or making some sounds? Did the baby, when you call the baby from any angle, do they turn? Do they smile when they hear your voice? Some simple things that you can do. But what you are doing nowadays is that parents are leaving children to enjoy the cartoon, watch cartoon as much as possible. But now we're having patients coming to us with delayed speech. You find that the child is about 4 years. When they take the history, the mother will say, this patient or this child of mine can hear but cannot talk. It's because they're having one way of communication that they do much of the listening. See, developing speech is two-way traffic. You listen, you understand, and you repeat. So we always imitate to develop the speech. Now that's about the congenital hearing impairment. Now for the acquired, you say you can acquire hearing impairment at any single age, be it because of the accident, be it because of the noise pollution, be it because of age-related, or many other factors that cause. It will depend, it's case by case to know what caused the hearing impairment. But also I would want to talk about the noise-induced hearing impairment, which is on the rise because of wearable devices that you are using every time, the stereo earpieces that you are listening to, the matatu industry, the juakali industry, the clubs, the noise that are exposed to so many people in they're having their good time in the clubs, and of course even to an extent churches, because we say noise is a noise, and it's a level that the noise should be controlled. So when the government like a good governor of Nairobi, Sakaja said, the noise should be controlled to a level because it is causing more damage than what people are saying that is enjoyable. So let's take care of it, because the noise-induced hearing impairment, it's irreversible. Once you have it, you have it, and nothing much will be done to retrieve it back or to revive it back or to heal what you already damage has been caused. So that is preventable, and we want to talk to our people, want to talk to the young generation who are using the wearables, stereo headphones, to take care of the much noise that they expose themselves to.
Mashida yangu naitwa David Dego Kamau. Niko hapa kwa ajili ya masikio. Masikio yangu ilikuwa na shida, na tena nimeona daktari, na daktari ameniona na nafikiria nitakuwa sawa. Madawa nimepewa bure, sijauziwa. Hata kuona daktari ni bure. Hakuna malipo.